Hello, I'm Cameron,
I'm Savannah.
And I'm Sierra.
and we chose to do our community health project on the evaluation of Susan G. Komen. So, the problem we chose to focus on is breast cancer, specifically in women. We chose to focus on this topic because breast cancer is the second most common cancer in women after skin cancer. The program that we feel best addresses the issue is the Susan G. Komen Foundation. The goal of this program is to reduce the current number of breast cancer deaths in the U.S. by 50% by the year 2026. In the year 1980, Nancy G. Brinker promised her dying sister Susan that she would do everything in her power to end breast cancer forever. In 1982, that promise became the Susan G. Komen Organization and the beginning of a global movement. What was started with $200 in a shoebox full of potential donor names has now grown into the world's largest nonprofit source of funding for the fight against breast cancer. To date, we have invested more than $2.9 billion in groundbreaking research, community health outreach, and advocacy and programs in more than 60 countries. These efforts helped reduce deaths from breast cancer by 40% between the year 1989 and 2016. And this foundation won't stop until the promise is fulfilled. Susan G. Komen is the only organization that addresses breast cancer on multiple fronts, such as research, community health, global outreach, and public policy initiatives in order to make the biggest impact against the disease. Some examples of status assessment techniques that Susan G. Komen utilizes are vital statistics and the U.S. Census. The CDC oversees the National Program of Cancer Registries, and within this system there are state and local registries. These give people the opportunity to self-report their cancer cases. So to know whether or not breast cancer rates are changing over time, you have to compare the rates rather than the number of new cases. For example, let's compare the number of new cases of breast cancer in U.S. in 2009 to the number of new cases in 2016. In 2009, there was an estimated 192,370 new cases of breast cancer in U.S. women. In 2016, there was an estimated 246,660 new cases. Although more breast cancer cases occurred in 2016 than 2009, this doesn't mean that the rate of breast cancer increased over this time period. We expect the number of cases to increase over time because the population of the U.S. increases over time. The more people there are, the more cancers there will be. Our population is also living longer. Since age increases the risk of breast cancer, we expect to have more breast cancers over time. To know if breast cancer rates are changing over time, we look at incidence rates rather than the number of new cases. The incidence rate shows the number of breast cancer cases in a set population size. It's usually written as the number of cases in a population of 100,000 people. The breast cancer incidence rate among women in 2009 was 131, and the estimated breast cancer incidence rate in 2016 was also 131. This means there were 131 breast cancer cases per 100,000 women in the U.S. population in both time periods. So although the number of breast cancer cases has increased over time, breast cancer rates were fairly stable.
There are many risk factors, both modifiable and non-modifiable, that increase one's risk for developing breast cancer. The non-modifiable risk factors are gender, advanced age, age at the first period, age at menopause, blood estrogen levels, and family history. The not modifiable risk factors are birth control, pill use, alcohol consumption, and breastfeeding. The main risk factor for breast cancer is being female because it's been proven to be about 100 times more common in women than in men. Family history is also important to look at because having a first-degree relative, both male or female, with breast cancer or a first-degree female relative with ovarian cancer also has been proven to increase the risk of developing breast cancer. However, breastfeeding has been shown to significantly lower the risk of developing breast cancer, especially in premenopausal women. Although there are many factors that put one at risk for developing breast cancer, there are also several myths that are linked to breast cancer that are not actually true. Research shows that both induced abortion and spontaneous abortion do not increase the risk of developing breast cancer. Studies show no link between cell phone use and the risk of breast cancer, and neither saline nor silicone breast implants increase the risk. Research shows no link between caffeine or coffee intake and breast cancer risk, and there have been concerns about deodorant and antiperspirant use and the breast cancer risk. However, studies have found no link between these. Over the past 5 years, more than 80 cents of every dollar spent by Susan G. Komen has gone directly towards research, community-based health programs, education and advocacy programs to support its mission of saving lives and ending breast cancer. There are various resources that offer both education and support. The Komen Breast Cancer Care Helpline offers free breast cancer support and counseling to anyone with questions and concerns. The Komen Breast Cancer website provides a wealth of safe, accurate, and current and evidence-based breast cancer information that has been developed with experts in breast cancer. Financial burdens can also be a significant source of stress for patients and often can lead to worsening conditions. So, most hospitals and treatment centers have financial counselors available to help patients work out a payment plan. All of these resources and programs are put into place to help educate, prevent, and ultimately decrease the amount of people affected by breast cancer. The overall long-term goal of Susan G. Komen Foundation is to reduce the current number of breast cancer deaths by 50% in the United States by 2026. They also hope to find new treatment for the most aggressive forms of breast cancer that are killing more than 41,000 people in the U.S. each year. Komen's focus is on understanding and finding more effective treatments, developing better therapies for aggressive forms of breast cancer that become resistant to treatment over time, and leveraging the use of transformative next-generation technology to detect breast cancer at the very earliest stage. Komen will do everything they can to ensure that all people, especially the most vulnerable populations, have access to and utilize high-quality breast cancer care. There are various programs and activities that the Susan G. Komen Foundation supports in order to help raise awareness and fundraise for those affected by breast cancer. The More Than Pink Walk is Komen's signature fundraising event where people can come together as part of a community to help people ready to take action. The Komen Race for the Cure is an education and fundraising event for breast cancer. The series of 5K runs and fitness walks raises significant funds and awareness for the breast cancer movement, celebrates breast cancer survivorship, and honors those who have lost their battle with this disease.
Susan G. Komen is well funded through the partnership of the companies that are pictured here. Through cause marketing, event sponsorship, philanthropic giving, community and employee engagement, and the power of volunteerism, these companies have shaped the face of the breast cancer movement. These companies, as well as many others, partner with Susan G. Komen through financial contributions and awareness-building events. Because it is such a large organization, they ask that their partners consider these 5 things before committing to a partnership. How is the program structured? How will the organization that benefits use my money? Is the program meaningful to me? Is the company committed? And who does the program benefit? Linked here is their promise and guidelines for transparency in the donation process. This organization's effectiveness is evaluated through the improvement in survival rates, which we will discuss on the next slide and previously discussed in the incidence rates. There are many survivor stories that prove the client satisfaction with this organization. Many stories are about how Susan G. Komen provided care and resources for the women diagnosed with breast cancer and their families. Overall, Susan G. Komen has provided more resources and educational tools for women, which was the greatest need that we found originally in the assessment. In the 70s, the total mastectomy was the standard procedure and very few women were routinely screened. In the 80s, 30% of women 40 years and older began receiving mammograms. In the early 2000s, genetic tests were developed to determine which patients needed more aggressive treatments. In the 2010s, research found that 70% of women with early-stage HER2 negative breast cancers can forego chemotherapy and its toxic side effects. It is clear that the program has had a long-lasting impact on the outcomes of breast cancer because of the major improvements that have been each decade as a result of the fundraising. The initial problem with breast cancer was a lack of awareness and resources. This has changed dramatically over the past 50 years with over $500 million raised by partnerships for research. The impact is visible with the 5-year survival rates of breast cancer. Stage 1 has a 98 to 100% 5-year survival rate. Stage 2 has a 90 to 99% survival rate. And Stage 3 has a 66 to 98% survival rate. All of these prove that Susan G. Komen has had a large impact on the overall care of women with breast cancer. When a nurse is caring for an individual with breast cancer, they focus on things like screenings such as mammograms, medication, education and administration, and family and patient care. When the nurse is on a planning committee, they're focused on connecting with partners to fundraise, comparing statistical data of overall outcomes of breast cancer treatment, and thinking of new ways to raise awareness. More research needs to be done on how genetics impact women's risk for breast cancer and how it can affect their treatment outcomes. Susan G. Komen has been functioning since the 1980s, and we believe it could continue as is. The short and long-term goals are being supported by the fundraising that is organized by Susan G. Komen. As women who have all been impacted by breast cancer in some way, shape, or form, we have really enjoyed doing this research. And these are, our references. Thank you for listening.